everyone. Welcome to the Ophthalmology Business Podcast. We help you develop your ideal practice with the help of other doctors and experts. And the topics we cover include marketing, management, leadership, recruitment, HR, mindsets, and so much more. I'm Dr. Shehzad Batliwala, Dr. Shez. I'm one of the co-hosts of this podcast. Every listener of this podcast is welcome to join the Ophthalmology Business Academy at obaacademy.org. The membership is on us, and it's our gift to you. Today, I'm super excited to talk about Dr. Shanika Esparaz, ophthalmologist and owner of the Envision Ophthalmology and Wellness Clinic. Beyond her expertise in eye care, Dr. Esparaz is also a dedicated lifestyle medicine specialist and a life, health, and wellness coach. So let's jump in. Did I say that correctly? Dr. Shanika Esparaz, right?
You
Shanika
did,
Esparaz?
yeah.
Okay.
Thank
All
you, Shez, for having me on the podcast today. Thank you, Ophthalmology Business. I think this is a great platform that we can all continue to learn and grow from, and I certainly have.
Yeah, well, thank you for taking the time to be on. So before we get started, why don't you just take a minute, Dr. Esparaz, and maybe just tell us a little bit about yourself, who you are, how did you get into ophthalmology, and just give us a brief background of your story.
Sure, yes. I grew up in Ohio, and my parents are actually from Sri Lanka. So I'm a first generation American. And so I'm sure many of us can relate to kind of growing up, immigrant parents, watching my mom, who is still a family medicine practitioner. She had opened her own practice. And so growing up, I was frequently at her office, just in awe of how she would do, managing her office, seeing patients, and most importantly, being my mom. So growing up with that, I kind of knew I always wanted to go into medicine. And actually, initially, when I went into medical school, I thought I was going to be a pediatric endocrinologist. I really, really liked diabetes and actually had done some research in diabetic retinopathy in my nerdy high school days for science fair projects. But then in medical school, I learned I really like to use my hands. And that's where I started exploring some surgical specialties and fell into ophthalmology, really. I love my medical school, Wright State in Dayton, Ohio. But we did not have an ophthalmology department. And so I really had to kind of forge my own path to try to get into ophthalmology. We had very few ophthalmology applicants from my medical school. I reached out to community ophthalmologists to shadow them, do case reports with them. And by the grace of God, I somehow got into ophthalmology. I trained at Boston University. And towards the end of my training, I really thought I was going to be a comprehensive ophthalmologist. But my husband, who is also in medicine, he's a radiologist, had one more year of radiology residency. So I decided to stick around in Boston for one more year, and I did a 1-year medical retina fellowship. Looking back, I'm so glad I did. It really opened up a lot of opportunities and doors for me. And so fast forward after fellowship, I had one child right before fellowship, moved back to Cleveland, Ohio, because my parents are here, and started in a practice. It was a multi-specialty group that eventually sold to private equity. And I am still with them part-time as their medical retina specialist. And in the last year and a half, I have opened my own direct care ophthalmology practice, where I practice medical retina as well as comprehensive ophthalmology. So that's where I'm at today.
Man, so crazy journey, right? And I can, relate to so many things in your story. One of those things is we all think we're going to start this journey a certain way, right? But fast forward like 10 years, from the point where we decide we're going to go to medical school and live this life, it's so different, right? It is so different. I could not have imagined that I would be doing the things that I'm doing today, back when I was starting this entire process. And the thing that that really speaks to me in your journey is this like immigrant hustle, right? I also grew up in a immigrant family, from India, also a first generation immigrant. And I also didn't have a home ophthalmology program, right? I went to an osteopathic medical school. And so, but we figure it out, right? Whatever it takes. I mean, that's how we're raised. We're gonna be resourceful, and we're gonna figure out whatever it takes to accomplish our dreams. So that's really cool to just hear about that journey of yours. I want to, over the last year and a half, you've kind of pivoted into creating this practice and clinic of your own, right? And you probably had to learn some skills to make that a reality, right? From a business standpoint. Can you tell us a little bit about what that took and just, we don't learn business and entrepreneurship in medical school and residency, but yet something changed in your mind and you decided that that's the route you want to go. Can you just walk us through that decision making process?
Sure. Yeah, you're so right. We really do not, and we really should be learning some business leader, more business and leadership skills in medical training, because that's how you really become intentional and really, get what you want, after training, when you're in the real world. And so I was actually really stuck with indecision for a while. I was in a salaried position, and it's great. You go to work, you don't have to hire, you don't have to do HR, you don't have to do billing. You do your work and you go home. And so that's the nice part of being salaried. You focus mostly on patient care. But I had an itch to really try something different, practice medicine a little bit differently, in this direct care model. And so, I was stuck with thinking, is this possible? Am I going to ruin my career by doing this? But then I also thought, what if I don't do this? What if I don't try this? Am I always going to be wondering, what life would be like if I hadn't tried to open my own practice? And I am a person that is in general optimistic, but you do have to have cautious optimism when taking a big leap like this one. And so I was stuck with a lot of indecision, but I did work with a business coach that helped kind of push me forward in the direction I really wanted to go. And like I said, I had an itch and I was like, all right, we're going to explore this. Um, and then to go back to something else you had mentioned about being resourceful. So when I was looking at opening my own practice, I had no business background, no MBA. I thought about it. I thought about, doing an MBA program. There's also like business schools specifically for physicians online. But what I decided to do instead was use my network, use my resources, and you're right, kind of that immigrant mentality of, getting scrappy and thinking, okay, what are my networks? Who do I know? And where who can be of most use to me? What are the questions I need to ask? So really looking within your community that you already have. And the nice part about ophthalmology is we're a small community. You
Absolutely.
meet people on social media, on at conferences, and there's a lot of tools already, within our small field. So that was kind of my mentality going into thinking about opening a practice.
Yeah, and you encounter a lot of limiting beliefs, it sounds like, right? On the way, fears and limiting beliefs that are justified. We're human beings and we value security, right? And safety. But entrepreneurship is just one of those things like it's this giant mountain and there are so many ways to the top of this mountain, right? There's not really one cookie cutter way. That's what I really like about entrepreneurship as a concept and a philosophy, right? That it's this path to freedom. And there are so many different ways that you can cultivate that. It doesn't have to be just one thing. And that's what I really like about the way that you've done it is, you are in this unconventional practice model, right? We've talked about it a little bit where it's direct to patient care. And it's not your traditional kind of 9 to 5, even Monday through Friday. It's not your full-time private practice. You're sort of molding it to what you want it to become. Let's talk about the focus of it, right? As an entrepreneur, I have shiny object syndrome, I call it, right? Like I want to do everything and I want to do it all at once. And as a business owner, you have to get really crystal clear on, who is it that you want to serve, right? And it sounds like you really sat down and thought about that deeply because you have such a niche product. So can you talk about, how that focus evolved as your understanding of entrepreneurship evolved?
Yeah. So I thought, if I'm going to do this on my own, so I decided to open a solo practice. I really wanted to make it about the doctor-patient relationship,
Mhm.
going back to the days where you could text your doctor if you had a problem, and where the physician, really knows, a lot of things about you, what you do, your family, and it's a relationship that goes both ways. And so I said, okay, based on that, how can I make this happen? And so I was very intentional about who I was going to serve. I knew that this model it's not able to serve everyone, but there are a subset of patients that are looking for quality healthcare and are willing to pay for that. And so I knew I also wanted to do things on my own, keep my overhead low. And in order to do that, I eliminated insurance right now out of the picture. I still see Medicare patients, and have learned to, how to bill Medicare myself. I was really proud of myself the first time I submitted my own bill to claim to Medicare, and I got like a whole like $30 from Medicare. I was really, really proud. So I was really specific in who I wanted to serve and what I wanted my practice to look like. And then I also, like you mentioned, it's called Envision. My practice is called Envision Ophthalmology and Wellness. And so I had for years wanted to incorporate my wellness background, my board certification in lifestyle medicine, and in coaching into my practice as well. So while I do see, traditional ophthalmology patients in my practice, I also do wellness coaching as well. And so being able to have a flexible schedule and model throughout my week has been really great. So I can cater to my patients' needs. I'm available to them. It's a concierge type feel for my practice. And then I can also do coaching, which is something I've wanted to do for a while as well.
It's so fascinating, right? Having a business, at least in my mind, if you're going to put your name on something and you're going to put everything you have behind something, it really needs to be an extension of who you are, right? And before you can do that, you kind of need to know who you are. And so it sounds like you have taken the time to really understand yourself, really know what you want and how you want to serve in this capacity of being an ophthalmologist, right? And you created something that is really a reflection of you. You have this wellness background, and so you want to incorporate that. You value that patient care relationship. You value, making people feel and seen, right, and heard. And so you made it happen in the context of starting a business. So many people, I think, chase money and status and fame and all these things, but it sounds like you really clarified your own values and then made your business an extension of that. And that's unique, right? That's not something you see every day. So I just want to acknowledge that and congratulate you on that. That's pretty cool to see.
Thank you. Thanks. You make it sound way cooler and more glamorous than it is. There's definitely, challenges and road bumps that I've encountered, but when you look back, and one of my retina colleagues had said, you know what, because he opened his own practice, Steve in Colorado. I don't know, Steve, while I'm blanking on your last name, it'll come to me. But he said, you know what, if I'm going to take a leap or a risk, I'm going to take it on myself.
Absolutely.
Bet on yourself always.
Absolutely. I couldn't agree more. So those hurdles and the barriers you mentioned, right? So let's talk about them. So what were, some of those like top two or three barriers or hurdles that you encountered in starting this private practice, and how did you overcome them?
So I would say number one that comes to mind is referrals. So this is a very different patient model that I'm in. It's a direct care practice, so I'm not in network with insurances except for Medicare. I'm not, I didn't start with a patient panel. I still practice part-time in another practice, but it's geographically in a very different location. And so the biggest hurdle has been patient referrals, talking to other docs in the area, explaining the model. Patients can get in a timely manner. They can text me if they have any issues or questions. They spend time with me, but it is out of pocket. So that has been a challenge, as well as I would say secondarily explaining this to patients who call me. Oh wait, you don't take insurance, or and so it's not for everybody. And
Hmm.
so I would say my third challenge has been, actually charging patients, because I'm my own checkout. I do everything. So really figuring out, how I value my services. It's nice because I get to pick, the price point for my services. But then, actually when a patient calls saying, yeah, this is my exam fee, and then collecting payment sometimes, feels a little awkward. And so those are probably my three biggest challenges: is patient referrals, explaining to patients the model of my practice, and then actually charging my worth. And so it's still a work in progress. When I initially opened, I went kind of door to door to various optometry practices and primary care practices, with eyeball cookies. Actually, the baker did not draw the eyeball cookies correctly. It was missing. I think it was missing like the optic nerve on the retina. So, try to bring some humor into when I was coming in to see these new docs. Like, hey, I know what I'm doing. I know these cookies are missing the optic nerve, but they taste good. um, so,
Oh, that's
just
hilarious.
hit to the ego here and there, where sometimes it's crickets from, people that I've gone door to door to and sent emails to. We do have a great direct care network in Cleveland that's growing. And so that has been a great source where patients who are already paying for health insurance like this model, this convenience, this access to healthcare, that's been a great referral source for me. So you find your resources, you figure out your networks, and then everything gets better with time. More practice, saying, you know what, these are my fees, and yeah, this I take cash, check, or credit card, or HSA account. And just getting used to charging your worth. Practice makes perfect or better, and I tell everyone, fake it till you make it.
Yeah, well, shoot, story of my life, man. Story of my life. So can you walk us through like maybe one of those patient interactions, right? Like when they're calling you and you're, you know, like in business, you kind of need to know how to sell, right? You gotta, and in our line of work, we're selling really our services. Um, but you know, in medical school, you're not taught this, and if anything, we're taught to kind of like establish that clear line, right, between business and medicine. But here you are, you're wearing all of those hats, right? And so how are you navigating those conversations where, your goal is not to sell anything to the patient, really. Your goal is just to be honest and transparent with the patient and tell them, what it is that you have to offer. And if they are okay with that transaction, then they'll proceed. Um but there is that like element of trust, right, that needs to be established between you and the patient so that they'll actually um agree to something like that. So can you just walk us through how that interaction looks?
Yeah, I would say the biggest thing I've learned is to not make assumptions. Not make
Mm,
assumptions that a patient is not willing to or does not want to pay for your services. So I've had patients call me who have insurance, have high deductible plans, who are Medicare Advantage plans, so they are on Medicare and, this is what they've, saved up for in a certain sense. And I've had patients without insurance call me and be more than happy and willing to pay. I've had all those types of patients call me and say, oh, okay, this isn't for me. And so I think what you have to realize and be okay with, it's not you, it's what they're looking for exactly. You're not selling, you're serving. I think when you think of it in a sense of serving another person, it gets much easier to do what you need to do to make a business run and work and to sell at your value. And so, usually when patients call, it's me answering the phone. So usually they're a little startled. They say, "Oh my
mhm.
gosh, I'm so sorry. Did I call your cell phone?" I said, "No, this is my office line. You called the right place. This is Dr. Esparaz. I do answer my own phone." And so
Wow.
that already kind of starts a different type of interaction than the patient was expecting. I make it really personal. I say, "Hey, how'd you hear about
Yeah.
my practice? I've only been open for a year, just curious." I get to know them a little bit over the phone, like actually treat them like a human, which is,
Yeah.
how we we would love to treat everyone in
Rare
every
these days.
situation,
Yeah.
but it's,
Yeah.
usually when you call the big hospital systems, it's a huge phone tree. And so
Heck yeah.
I just keep it very personal, like as if they've called my cell phone. I hear, what they're interested in or what their problem is, and I say, "Hey, I can get you in tomorrow." And so that convenience of getting in quickly helps. Usually, a patient is calling you because they need something, they need help with something, they're worried about something, and so being able to offer your availability, being they talk about the three
Hmm. Hmm.
A's, right? Affable, available, and able. And
Exactly.
so, just like you said, your business, it's an extension of you. So, showing that already on the phone, you're friendly, you're available, and then telling them exactly how you can serve them compared to, maybe the bigger, hospital systems that maybe, there's a reason that they called you. There's a reason they picked up that phone, Googled you or whatnot. And so being able to find out what that reason is, and then being able to tell them how you can serve them, I think can help in a non-traditional situation like this in a cash pay service.
Man, that is like beautiful, right? We live in this age of like personalized medicine and with AI and all of these things, but really personalized medicine is what you just described. It's that personal relationship with the patient, right? The patient calls you and they're shocked that you picked up the phone as the MD, right? I mean, that tells you so much because like if I was on the other end of that line and I was the patient, I would immediately be attracted to someone like that, right? And want to receive care for someone like that because hell, if you can, I don't know what it is about that, but it's like if you can bring your ego down, right, and actually like be there to serve in all aspects, um, even to the point of, hey, this is me, I'm scheduling my own patients, right? Then that patient's gonna be like, "Look, this person cares and they're going to take care of me, right?" And so I love that personalized nature to how you practice medicine. I've thought about going out and venturing out on my own, and that's probably going to happen in the next few years. And it's inspiring, right, to hear that there are people that are doing it in that way. So that's pretty cool. um what has been your, I mean, I think I already know the answer to this just talking to you, but what's been kind of like your, you know, uh your secret sauce, right? Like you're obviously successful as an entrepreneur and at what you do. What do you think is the thing that really contributes to that fundamentally?
So I would say I always acknowledge that I'm not doing this alone. Although I am the one answering the phones and so forth, I have a great support network. Because there's been several times where I'm like, what am I doing? I made a huge mistake. But I have, my family support behind me, my husband especially, and some close-knit friends that have been along with me on the journey. So I think always having your cheerleaders and people who will bring you down when you're on, cloud nine and you got to keep things real. Um, I have a lot of great people in my life, and so I have to really say that number one, and number one is my husband. So great support network. And then number two, I did a lot of mental work to get ready to take this leap of faith in myself. I think we talked before about this, but I got coached and just really had to learn how to sift through my thoughts. What thoughts are true and what thoughts are, what am I telling myself? It's very easy for our negative kind of internal narrator to take over. We're very hypercritical of ourselves and perfectionists because we're in medicine, right? The stakes are high. We make a mistake, someone could lose their vision. And so that type of thinking, however, many times restricts us from wanting to take risks, out, in our whole career, in our personal life. And so I really had to retrain my thinking in saying, this is going to be okay. I've, done the pros and cons. I've looked at XYZ. I've got, my lawyer in place. I'm renting a space. I've got my equipment. I'm okay. So the mental work was really important.
Yeah, and that's kind of what I was gonna say. I can tell that you have really worked on um, your mindset. Yeah, and just we all have these limiting beliefs. I certainly do, and over the last couple of years, I have surrounded myself with coaches as well. I have a business coach. I have kind of a life coach, if you will, and I even talked to a personal trainer today, so I think I'm gonna get coached on that level as well, right? But just surrounding yourself with people who can see those blind spots and can help you knock down those limiting beliefs so that you can believe in yourself, right? And then having that support system around you to just keep encouraging you, because inevitably, like, life will happen and we will hit some hurdles, right? Failures, if you will. But as long as you're learning from them, they're not failures. They're opportunities for growth, right? But that type of mindset and thinking, man, like if we had that in medical training, right? I think we would come out of medical training so much stronger and just ready to take on the challenges of being a doctor. Um, but we don't have that, and so we kind of have to figure those things out on our own. Um, Man, this has been really good. This has been really good and inspiring for me, to take it all in from someone who's several years ahead of where I am in training. So thank you for being an inspiration. Um, we're gonna round it out with maybe one or two more questions. So I'm curious. There's so many things that you have to do as a business owner. Um, But if you had, like, a limited amount of time per week, right? Or if there's only like one thing you could do, dedicated to your business, like let's say you had like 2 hours a week to dedicate to your business. What is that one thing that you would focus on that would make everything else kind of fall into place for your business?
Hmm, that's a really good question. And something a coach would ask to a business coach. Yeah, that's a really good question. You got my wheels turning. I would try to get in front of more people because the more people you get in front of, the more people you can find your people, your patients, the people you want to serve. So if I had an unlimited amount of time, I would find some way to get myself either in person, speaking at a community event, or um, a meeting of some type that my patients would naturally be at, a social club or um, a local Rotary Club or whatever it might be. I would find a way to get in front of more people in person. Social media can be helpful, I think, with certain specialties. I do medical retina, so most of my patients are in their 70s, 80s, not so much on social media. But I do think if I was like a refractive type surgeon, cash pay or plastics, I would try to get myself in front of more people on social media as well. Just getting your message out there and getting in front of more people, you're going to be able to find those patients that you want to serve. Your business will continue to grow.
Awesome. That is really good advice. And it's scary to put yourself out there in front of people like that, at least for myself. And so, what would you tell someone like myself who maybe has some hesitation in putting yourself out there? Right? Because, you know, I don't know, like I think there's extroverts, there's introverts, and it's a spectrum. And a lot of people who maybe identify as introverts or maybe that part of the spectrum, you know, I think they can also be entrepreneurs, but there's a hurdle that you have to overcome so that you feel comfortable putting yourself out there in front of people. How do you go about doing that?
Great question. And I myself, I would call myself an extroverted introvert. I am
Oh, really?
not the
How do you
most,
define that? How do you define that?
I, so as someone who is quieter, likes their own time and,
Yeah,
is kind of a homebody, but I, I can, perform and
yeah, okay,
and in certain situations, networking bubbly and things like that. So I call myself an extroverted introvert, and I do not like public speaking, but I've said yes to many opportunities to public speak, especially right out of training. That really kind of pushed me more into the space. I'm very active on social media, and it's a great place to just talk to your audience or practice talking to your audience. So I would say number one advice is to keep putting yourself out there, keep pushing yourself. The more you do it, the more natural it becomes. And then number two is you've gone through medical training, you've done hard things, you've learned new skills. Putting yourself out there is just another skill that you're going to learn and you're going to get better at it. And then number three, uh, a business coach told me this once before is whatever clientele you're serving, you only actually need to know 10% more than they do. Obviously, as physicians, especially subspecialists and ophthalmologists, we've put in tons of years into training, into our craft, into our field. We know a lot more than our clientele in this respect. And so you have to realize that you're the expert and people are looking up to you and you're serving them.
yeah. We know a lot more than our clientele, and we know a lot more than we think we do, than we give ourselves credit for, right? And so just believing in yourself and all of the work you've done to get to this stage of life, especially as a physician. I mean, you forget, right? You forget all of those years of studying in the library. And like I gave a talk to my medical school last week and I took a tour of the library just to kind of refresh my memory. And I got so nostalgic, right? I was like, man, I slept in that chair at 3 in the morning, 'cause I was so exhausted. I didn't want to go home because I was just studying my butt off. And so we forget the amount of time we've put in. And, like now I can operate on eyeballs. And I never thought I would ever be able to do that in my entire life, right? And so if we can learn that skill, then just like you said, this is just another skill to refine and learn. And there's nothing that says we can't do that.
Mm-hmm, for sure.
Awesome. Well, any parting thoughts or words, advice, anything you want to say at all to our viewers?
If there's something you want to do, go for it. You got one life to live. You will learn the skills, you will figure out, you will use your resources to get where you want to get to. But you got one life to live, so go for it, whatever it might be.
That's beautiful, and it's morbid to think of it this way, but sometimes I get a little morbid, right? When it's like, what if I die tomorrow? That's very
Yeah.
possible, right? And
Mm-hmm.
so why would I want to live with regrets, right? We have one shot. We should absolutely take it. So that's a beautiful parting message. Thank you so much, Dr. Esperaz, for joining
Thank
us
you.
today and talking to us about your life and your take on what it means to be an entrepreneur of your own life. Really, we appreciate it a lot. I also want to take a moment to thank our listeners. We appreciate each and every one of you. We can't do what we do without you. And so please, if you like the conversation and the podcast, share it with your friends and on social media. And please don't forget to write a review on iTunes or Google Play. Until we meet again, I wish all of you an amazing week ahead.